Hey everyone, Zoe here. Welcome back to the channel. Today, we're diving into an important topic that affects both nurses and patients alike: mental health legislation and ethical practices in nursing. Whether you're a seasoned healthcare professional or just starting your journey in nursing, understanding the legal and ethical framework surrounding mental health is crucial. We'll break down complex legal jargon into easy-to-understand concepts, explore real-life scenarios, and equip you with the knowledge you need to provide safe and ethical care. Remember, advocating for our patients' rights and well-being is at the heart of what we do. So grab your notebooks, get comfy, and let's get started. Let's start by discussing some major mental health laws. One of the most significant ones is the Mental Health Act. Now, this act can vary slightly from region to region, but generally speaking, it lays the groundwork for things like involuntary commitment, also known as involuntary hospitalization. This means that a person with a mental illness can be admitted to a hospital for treatment, even if they don't consent to it, but only under very specific circumstances. The Mental Health Act ensures that there are safeguards in place to protect patients' rights. For instance, there are requirements for things like court orders and mental health evaluations before someone can be involuntarily committed. This ensures that decisions are made carefully and that patients' rights are protected throughout the process. Now, in addition to the Mental Health Act, it's essential to be familiar with disability laws, particularly the Equality Act. This law prohibits discrimination against individuals with disabilities, including those with mental health conditions. The Equality Act ensures that people with disabilities have equal opportunities in all areas of life, including employment, education, and access to healthcare services. For nurses, this means understanding that we need to provide reasonable accommodations to patients with mental health conditions to ensure they have equal access to our care. This might involve things like providing materials in alternative formats, offering extended appointment times, or ensuring our facilities are physically accessible. Chapter 3: Implications for Nursing Practice, Putting it all into action. So how do these laws actually impact our day-to-day practice as nurses? Well, first and foremost, they highlight the importance of patient confidentiality. Anything a patient shares with us about their mental health is protected health information and should never be disclosed without their consent. Secondly, these laws emphasize the need for informed consent. Before we provide any treatment or care related to a patient's mental health, we need to make sure they fully understand what it entails, the potential risks and benefits, and any alternative options available. Finally, these laws remind us of our duty to advocate for our patients. If we believe a patient's rights are being violated or that they're not receiving the care they deserve, we have a responsibility to speak up and advocate on their behalf. Chapter 4: Ethical Principles in Nursing Guiding Our Actions. Now let's move on to ethical principles, which are equally important as legal guidelines in nursing practice. One of the fundamental principles is autonomy, which means respecting a patient's right to make their own decisions about their health. Another crucial principle is beneficence, which means acting in the best interests of our patients. This involves providing compassionate care, showing empathy, and always striving to do what's best for their well-being. We also have non-maleficence, which means avoiding causing harm to our patients. This seems obvious, but it goes beyond simply not inflicting physical pain. It also means being mindful of our words and actions and ensuring that we're not causing emotional distress. Chapter 6: Ethical Checklist for Nurses, Navigating Complex Situations. So let's wrap up with a practical checklist of ethical principles that you can keep in mind while caring for patients with mental health conditions. First and foremost, always prioritize patient confidentiality. Remember, their mental health information is private and should never be shared without their consent. Secondly, ensure informed consent. Before providing any care, Make sure your patients understand their treatment options, the potential risks and benefits, and any alternatives available. And finally, advocate for your patients. If you believe their rights are being violated or that they're not receiving appropriate care, speak up and advocate on their behalf. Outro: stay informed, stay ethical. Thanks for watching. If you found this video helpful, don't forget to like, comment, and subscribe for more informative content. Understanding mental health legislation and ethical practices is an ongoing journey, and I hope this video has provided you with a solid foundation. Remember, as nurses, we have a responsibility to stay updated on the latest laws and ethical guidelines to provide the best possible care to our patients. Your commitment to ethical practice makes a world of difference in the lives of those we serve. Stay tuned for our next video, where we'll delve into more fascinating topics in nursing. Until then, stay informed, stay ethical, and take care.